Welcome to the Clearly Beneficial podcast, the show where we rip off the Band-Aid and explore the future of healthcare, benefits, and the people driving innovation in the industry. This episode is brought to you by Health Next, the company leading the way in helping employers build enduring cultures of health and well-being, reducing medical cost trends, and increasing organizational performance. To learn more how they can help you, visit healthnext.com.
Welcome to the Clearly Beneficial podcast. This is your host, Vincent Catalano. We're going to go back a few years, specifically to 2021, where I was a guest on Blue Shield's Healthy Dose of Dialogue podcast. And at the time, I was an active insurance broker and was interviewed by one of their senior leaders, Don Antonucci, about enterprise health solutions. And I recently went back and re-listened to that. And then my friends at Blue Shield gave me access to the original audio file so that we could repost it as a fresh episode here. The key to this is that listening to that podcast from 2021 kind of made me feel bad in the sense that not a lot has changed in the employee benefits business. Employee benefits is still complicated. The price has gone up probably 50% since then. And employees aren't trained to the extent that they should be. The other thing is that I don't see that partnership between senior HR leaders and senior finance leaders as one that has taken root and has led to benefits within the organization. I still feel like both those organizations are in silos and still speak past each other. So give a listen to what I said almost 5 years ago and see if it resonates with you. And please comment and let me know how you feel. Thanks again for listening.
Hi, everyone. Thanks for tuning in to another episode of Healthy Dose of Dialogue podcast. I'm your host, Don Antonucci, Senior Vice President of Growth at Blue Shield of California. My guest today is Vincent Catalano. Vinny is Senior Vice President of Employee Benefits at Lockton, a privately owned consulting firm serving more than 50,000 clients around the world in areas of risk management, retirement, and employee benefits. He has more than 20 years of experience in healthcare and in the insurance industry, leading and designing innovative healthcare benefit programs and solutions. In this episode, we'll hear from Vinny about how he and his team at Lockton are reimagining healthcare purchasing, how to choose sustainable, affordable health programs, and what employers and patients can expect in this evolving market. Thank you for joining me, Vinny.
Thanks, Don. Well, you get two Italians for the price of one.
That's right. That's right on. Love it. So, hey, to start out, Vinny, I'd love first just to have our listeners learn a little bit more about your background. I mean, you have 2 decades of experience in employee benefits and consulting. So what is it about the healthcare industry that excites and motivates you? And also, how did you get into this industry?
Okay, well, I'll start with that. It's kind of I don't think anyone in the industry starts out saying, I want to get into the insurance industry. Okay, we're all accidents in some way, shape, or form, I believe. And in grad school, one of my colleagues, Bob Emery, just, and it ran conversation, says, he was a benefits broker. And he says, Vinny, I think you'd be good at this. And I was like, okay, what is it? So it took about 5 years for me to get my brain wrapped around it. And I ended up joining a small independent brokerage in Sacramento and started, not knowing what I didn't know. I just, dove into the business, learned as much as I could, focused mostly at that time on small groups, and really, made an impact pretty quickly. A couple of years in, we were acquired by a large international brokerage. And that allowed me to spread, my wings and grow into larger organizations in the public sector and private sector throughout California. And, the ACA, Affordable Care Act, kicked in along the way. And that made for a lot of change for a lot of people. And I think that is the theme. Don, when you ask me, what motivates me, it's change. It's this constant evolution. And I'm sure, as we'll cover in this conversation later, the role of what I do has evolved dramatically in the last, 24 to 36 months. And so it's the change, it's the opportunity to help employers take better control over the cost of this very expensive thing.
Yeah. And so what has been, you've got a front row seat to a variety of different clients and employers in terms of how they've experienced the pandemic. And I know it's different for different employers, but as it relates to healthcare and benefits, what are some of the things that have shifted or accelerated from your perspective because of what we've been going through with the pandemic?
Now, that's a great question. The pandemic is obviously something that just sort of happened to everyone. But at the same time, we were not only dealing with the pandemic, but you're also dealing with social equity issues. The pandemic caused this work from home phenomenon. To be in HR today, human resources, it is in my opinion, it's a very, very, very tough job. I mean, HR teams are stretched, high turnover in that role, as I see throughout the industry. It's been one of those things where the pandemic has caused a lot of people to think differently about a lot of things. Engagement, how do we compensate our employees, the value of benefits. But it's interesting that those conversations, when I look at Lockton's talent and culture survey, benefits and comp actually fall lower, way lower on the scale than things like diversity, equity, and inclusion, culture and engagement, change and transformation, leadership skills and up training. So the world of HR has really been thrown into a tizzy. At the same time, financial leaders in organizations, the C-suite, are all of a sudden looking at benefits and all of a sudden they're waking up and they're going, wait, this costs what? And let's go back 20 years when I started in the industry. A single premium for an average plan was what, about $200 a single, something like that, maybe 150, And so when they got that 10% increase every year, that 10% on 200 was $20, no big deal. Today, that average premium is $500. Okay, and that 10% increase represents $50. So it's just simple compound math. In 5 years, that 10% every year equals $863. Mm-hmm. And companies aren't prepared for that. They're just not. So the finance part of the organization is taking a bigger view. HR is working on any number of other initiatives that affect the organization. And, one of my, stump speeches, if you will, is to really try to get those teams talking to each other more effectively. Mm-hmm. Because they talk past each other. And if you can get the financial teams working with the HR teams and finding common language, that is where you start to evolve the sustainability of your plans.
Love that. Vinny, it strikes me too, while there's quite a few, we in our audience will have employers listening to this, influencers, legislators, et cetera. But, what strikes me too in healthcare, sometimes we use a lot of acronyms and a lot of inside talk. But as you describe the role of a broker or a consultant to family members or people outside of the industry, could you just describe for folks, what is it that you do? How do you describe that?
Oh my gosh, what do I do? In its core, I'm there to find efficiencies across the benefit offering, right? So a lot of organizations just do benefits. I give them a health plan, I give them dental, I give them vision, I give them whatever, and they pay no mind to it. It's just this cost of doing business that they give. And so when I tell people, I look for hidden opportunities to find efficiencies for long-term cost-effective sustainability. That's a lot of words, but you know, no one ever asks what I do because I'm in the insurance business. Nobody wants to talk to me about that. They'd rather talk to me about what I do on the wine side. They don't want to talk about.
We're going to get to that. We're going to get to that. That's excellent. Hey, so a question that I have for you is, from an employer perspective, then what is some of the biggest healthcare misconceptions that an employer has when searching for healthcare offerings?
Well, I like to say that, praying for a good outcome every year is not a strategy. Okay. And I would say that most organizations do that. They do not have a strategic plan around benefits. It's not a proper defined business process in most organizations. Most companies look at their annual healthcare spend year by year by year. And the renewal comes whenever the broker chooses to deliver it. And all of a sudden that sets the brain in motion about, well, now what do we do? Okay, well, if they, like I said earlier, I think everybody's been lulled into this thing where they get a 10% increase every year. And if it's higher, we have to do something about it. If it's lower, the broker walks in with a rate pass or a 5% increase. Hey, we're popping bottles. Yeah, I beat up the insurance company. That's just not reality and not sustainable. So when we go back to the math I did a few minutes ago, most organizations are if they actually thought about it, would be absolutely appalled to realize that in 5 years, at the current rate of increase, they're not going to be willing to spend what they spend. And so what happens? They water down the benefits. They increase deductibles, out-of-pocket maximums, all those things. And then the employees, get mad at the organization for raising their costs for either premium or out-of-pocket expenses. So I think the big misconception is that it's okay to pray about your annual benefit strategy, and that you are okay with the spreadsheet wrangling broker that comes in and throws out a bunch of numbers, and you sit there and you try to make a decision based upon that, versus taking a step back and saying, okay, here we are today. Why are we offering benefits? What value do our employees play in the equation? And then what is this? How can we chart out a course for 5 years ahead? And going back to what motivates me, what excites me about this business, it's having the opportunity to have that conversation with an employer to help them see the future. And that is the big misconception, I think, is most employers think it's just this thing that at 35% or more of payroll spend, benefits are pricey.
Yeah, it's really important. I've been doing this for, just as long as you have, more than a couple decades in healthcare. And a lot of that's been on the health plan side. And I would say, boy, there's a handful of employers that I can think of that actually have been focused on their healthcare programs like you're describing, and they get results for sure in a different way. And it has always been surprising to me, why that hasn't shifted more. So from your perspective, is it just that, hey, this isn't a core focus of their business, even though, really it should be? We've all seen different stats out there about, different, companies or services that when you take a step back and look like what you're paying for healthcare versus maybe the products you're delivering, whether it's cars or, whatever it might be, that, boy, spending some real time there and some strategic time with a broker or consultant, but also with your own team and staff, pays significant dividends back to the company, but also importantly to the health and well-being of your employees. So based on all that, and I know you agree with that, where have you seen employers? Are you seeing it? Are they starting to shift more into actually looking at it from that strategic way? Or is there just still a long way to go because it's really just that annual process and now we got to look at it?
Well, if you look at some of the research that's been published, some of the papers I've read in the last 6-8 months, the financial suite, CFO, CEO, are definitely taking a harder look at benefits. I mean, listen, the CFO and CEO are actively involved in all of the other risk management insurance decisions, whether it's E&O, D&O, general liability, property, casualty, cyber, all those lines of coverage, and when they look, if they actually took an objective look at what they spend on those coverages versus healthcare is going to be higher, but they stay away from it, for whatever reason, because in their minds, they give that control to the HR staff, and the HR staff, is not financially trained, and so they take the advice of the third party, which is the broker or consultant. And, and so it's this weird thing that goes on. And to me, it's always, I joke and say, it's kind of like a game of telephone. The broker whispers in the HR person's ear, the HR person then repackages it and then delivers it up to the C-suite. And there's a lot that gets lost in translation. And then there's been times where I'll get the call from the CFO, what does this really mean? Or, and they're all angry at that point. And so it doesn't have to be that way. I mean, for me, those organizations that have figured out to get all of us in the same room at the same time to talk about the same thing and develop the strategy. And listen, I mean, to be fair, Don, larger enterprises do this, okay? I mean, that 5,000 plus space. I mean, you've got people who make benefits a strategic part of their business process. But I say in the solid mid-market, in that 100 to 5,000 space, I would say that there's a lot of room to grow from organizations. And the other thing is, and the data as well as I do, throughout, say, California, when you analyze all the groups that are insured, 75, 80% are fully insured and 20% are self-funded, where if you go anywhere east of California, the ratio is reversed. More organizations are self-funded back east. And, I think part of that is the appetite for risk of the insurance companies, but also that other, equally large umbrella and, gorilla in the room that starts with a K, with a large, market share. It creates underwriting challenges for everyone to have choice. The ones that are winning are the ones that go all in with one carrier, I think, in a lot of sense. They can find strategic opportunities, find ways to save money, and partner well with the self-funded, or type way of doing it level funded, whatever it might be. But those who want to get control over their healthcare spend would start to be better advised to lean into self-funding, captives, level funded solutions or other things where they can actually see the data and do something about it.
Yeah, it's a great point. I mean, I spent the first part of my career on the East Coast in New York, in New Jersey briefly, Maine, and it's very different in terms of the appetite for different products, whether it's health savings accounts, or high deductibles, and what's acceptable versus what I've seen in California, Oregon, Washington State, where I've spent the last decade. So I agree with you. And your point on the larger companies are doing this, I agree. I also think, and maybe it ties in a little bit about some of the more paternalistic, I think, customer profiles on the West Coast. But even for some of the large jumbo companies, I would agree they've got strategy and thought around it. But I also think that there's still quite a bit of ways to go for many of them in terms of really understanding the opportunity and also the waste and sort of the malfunction that's in healthcare. I mean, I work for an employer, Blue Shield of California health plan, that says, hey, you know what? We got a broken system, and we're looking to create a system that's healthcare, that's worthy of our family and friends and sustainably affordable. And we're the first to say we're not there yet by any means. And so I think employers have an opportunity to continue leaning in and not find some of that acceptable. And there are some solutions out there that start to drive them in that manner. So, I mean, would you agree with that? I mean, that there's still a ton of opportunity for some of those.
There's huge opportunity, Don. And the challenge, of course, and is a fully insured no fuss, no muss solution is, I like to show a picture of a car that's already put together, with everything, and a chassis of a car that has nothing bolted onto it, and you have to bolt all the things onto it to make it run as a self-funded plan, because, but the self-funded side gives you so much more flexibility. You get a deep understanding of your workforce. You get to target conditions that might be endemic to the workforce. You can manage your pharmacy spend so much better. I'm a big believer in looking at employees not as a group of people that you're giving this thing to, meaning benefits, but as a group of people who are equally invested in the success of the health plan, right? Most organizations don't train people how to use their plan, right? They give them a sheet at open enrollment. This is what the plan does: copay, co-insurance, blah, blah, blah. But they don't tell them how to use it. They don't tell them how to talk to their doctors about drugs. They don't talk to them about, well, before you go to the ER, you might want to tap into the telemedicine app or the 800 number on the nurse line, just to triage what's going on before you spend $5,000 over at the ER. So I think organizations, if they begin to look at their employees as value-added members of the health plan and stewards of the health plan, and get them to think like consumers of the health plan. And I don't care whether you're high deductible or rich plan, whatever. The point is if you can get your employees to think like they're part of the thing, you will have better outcomes long run at lowering, at bending the curve somewhat.
I love that. I think you're right. And I also feel ownership, or the industry, I think, feels ownership of doing a better job too of serving those things up, so that you don't have to have employees hunting and pecking and understand. I mean, how many times, Vinny, have you talked to somebody, either yourself in your own family or in the industry? I've got many examples of in sort of myself where I'm like, if I wasn't in healthcare, like, yeah, I figured out how to do this because I live and breathe this every day, and it still wasn't perfect. Or I'll watch, some of my family members go through the system. And when you look at it from the industry, from that perspective, from the actual end consumer and member and patient, we got a ways to go, because I'm like, yeah, of course I can find that after a lot of work, but doesn't that tell you something? So any comments on that? I mean, how often do you see that happening?
I mean, Don, I tried to refill a prescription on Lockton's insurance company's, website not long ago, and I almost lost my mind. And I'm like, if I can't do this easily with 2 clicks, how is someone else going to do this who's uninformed? I start at the very basic level, right? I believe that Americans only need to know 5 things about healthcare, right? Very simple. If you can know the definition of premium, deductible, copay, co-insurance, and out-of-pocket maximum, if you know those 5 terms, you are way ahead of the game, because I hear people confuse HR executives, CFOs, CEOs. They confuse all those terms all the time. And in my mind, 0.0001% of the population knows what a maximum out-of-pocket is. And so when I think that's like the most important term of all of them, when it comes to the function of a health plan. So, I think, my thinking over the years has shifted. I kind of believe that 80% of the population is pretty healthy. They don't need they go to the doctor whenever they feel like. It's not a big deal. They're healthy people. 18% are a little more frequent, 19% are more frequent flyers, and they access the system more. And then you got that 1% who are just, in it, and they have no choice over it, whether it's a chronic condition or cancer or, whatever it is, they're the heavy utilizers. And in my mind, and you can't control that. We look at those renewals every year, and we look at those 5 large claims, and those are nothing that a wellness program is going to do anything about. But if we can target those people in that 18% or 19% to use healthcare more efficiently, that will make a difference.
Yeah. So one of the things I noted is that Lockton released a top 2021 talent and culture priorities and practices report that was based on feedback, I think, from something like 600 human resources leaders. Can you highlight a few of the key takeaways from that and anything that you found either surprising or particularly interesting?
Well, I mean, I think, when you look at and I've got it right up here on the screen, so I was prepared for that question. The top thing that organizations are looking at are culture, engagement, and the employee experience. So all those 600 plus locked-in clients, 2/3 said that is like their number one priority. So people are mindful of the fact that now that they're allowing their employees to work from home, or some percentage working from home, we need to engage them better. And we need to put them as a priority and make sure that they're feeling part of the organization. So how do we shift our culture? What tools do we need to use to engage them better? Obviously, diversity, equity, and inclusion is number two. For literally half of the group said that was their top, one of their top priorities. And then how do we change and transformation? So change and transformation is number three. So you can see that change is afoot. People are thinking about it. The challenge is, it's a little of the blind leading the blind, and hence the world for consultants in all these areas. Okay, or they come to people like me and I help them tee up, because this survey was run by Lockton's Talent and Culture Institute out of Kansas City, and they have a great team of people and great resources that are third-party resources that we can refer into organizations. But the surprise to me of this really was that when you go on down, only 8%, look at things like educating employees on employee benefits. Educating employees about resources and benefits, 8% of the organizations are worried about that. Compensation and reward programs, 12%. So those issues are literally a factor of 6 lower than the top priority, which is culture, engagement, and employee experience. Now, in my mind, benefits education should be wrapped into the employee experience. How do we, get people feeling good about the organization? How do we give them the resources they need, whether it's mental health resources or whatever it might be, and education? And then at the same time, teaching them how to use their benefits more effectively. I think we can weave very nicely into the employee engagement and experience, part of the dialogue.
Very interesting. So I wanted to kind of turn to some fun rapid fire questions with you. So in one word or a sentence, Vinny, what's one thing that you do to stay healthy?
Peloton.
Love it.
Very simple.
How long have you been using it and how active are you?
I'd say, like I said, I finished I'm coming up on my 700th ride. I've had it for about 2.5 years. And it's the thing, man. I'm on it 4 or 5 days a week, anywhere from 20 minutes to an hour. It's changed my life. I mean, there's no other way to put it. And I don't, and that's not a commercial for them. I mean, that's just, it suited me very, very well. And I'm actually equally proud of my wife, who I bought this for me and I didn't think she was going to be interested in it. She has more rides on it right now than I do. So it's a family thing, and it's really, really good.
What is the most used app on your phone?
The most used app on my phone is probably mail. I mean, I am on and that's my thing. You're constantly doing that. But the second most probably in the off hours is Instagram, because of my wine thing, which is just a hobby and a little wine education thing called Vines with Vinny that I've been doing since the middle of last summer, where I just post wine reviews. I interview. You're interviewing me. I interview wine luminaries throughout California and beyond. And to me, it's just a hobby. It's just a lot of fun to show people that somebody who really didn't know a lot about wine can learn about wine and experience it a little different.
Oh, I'm checking that out in real time here. So you got 1,532 followers there, Vallens_with_Vinny, and now you've got an additional follower. So
Well,
very
thanks,
nice.
Don. That's great. Thank you.
When you're not working, what can we find you doing?
I say, my wife's my best friend, and she runs her own business. She's an interior designer of some note. And, we constantly talk about the business. I mean, sometimes I think I'm an interior designer, but I'm really not, But the point is we talk a lot about that business as well. She is chair of the board right now of the American Society of Interior Designers. So perhaps I play the role of consigliere once in a while and give her my 2 cents, and she can take it or not. So I think that's a lot. We have, I have a son from previous marriage, so he's 30 years old. He's gone and out. We don't have pets. So, it's good to be living with your best friend and be able to have those conversations about pretty much everything, or I have a book in my hand, which I love reading. So
that's excellent. Well, thank you, Vinny. This was tremendous. Thanks for your time here on this podcast.
Absolutely, Don. Thank you for having me. I appreciate it.
You got it. And for our listeners, thank you for taking the time to listen. I hope you walked away with some key takeaways here. I mean, first of all, just inspiration from Vinny and what he's looking to do to improve the health purchasing and outcomes through different strategies that, employers in particular can be looking at in a different way. And I think, what really resonated in this conversation as well is just the importance of education, communication, and thinking strategically about health plan benefits. It's a significant expense. And I know that Vinny and, what he's able to do with his colleagues at Lockton, there's a lot of different solutions that employers could be and do consider out there. For more information about Lockton, visit lockton.com and join us next time as we continue to bring you a healthy dose of insights and perspectives based on conversations with leaders who are transforming healthcare. We'd love to hear your feedback. Share your comments with us and let us know your thoughts by writing a review on Apple Podcasts. And you can also join the conversation on LinkedIn or Twitter at Dose of Dialogue, or visit our website at doseofdialogue.com.
This podcast reflects the personal views of the host and guests, not their employers or sponsors. See you next time.